So, ladies and gentlemen, welcome once again for all the ones that have just recently joined us. And today we're going to discuss a very, very interesting session. And this is about the dengue virus biosafety. So this is going to be an analysis of the evidence, the global inconsistencies, and the risk groups. This is something very, very relevant, but also that can be applicable. And we can use all these concepts, all these methodologies to see if what would be like the impact with other arboviruses. But first of all, let's start going to what we are going to discuss. We're going to cover the summary, then we're going to go through the introduction, and then we are going to discuss different characteristics, the clinical disease, transmission modes, and so on and so on. And then we're going to jump into the discussion and conclusion section. So without any delays, let's go to the summary. So the biosafety of arboviruses, including dengue virus, has become critical, yet often underestimated area in global health security. So these viruses transmitted by arthropods like mosquitoes are the ones responsible for widespread outbreaks in tropical and subtropical regions, with dengue alone affecting hundreds of millions annually. And if you go to the WHO website, if you go to many, even if you just look on any browser, dengue virus statistics, you will see that there is like a tremendous impact of this disease all over the world. Despite the significant disease burden, there is a surprising lack of consensus regarding their appropriate biosafety containment. So, for example, dengue virus is handled at a biosafety level 2, what we know as BSL-2 in so many countries, while others require BSL-3 practices for certain laboratory activities, especially involving viral cultures or vector infection studies. These inconsistencies stem from variable risk assessments, differing interpretations, transmissibility, pathogenicity, and a lack of global coordination in biosafety standards for arboviruses. So this is very important, and keep this in your mind because we're going to use all this information at the end of this presentation. So this patchwork containment levels increases the risk of laboratory-acquired infections and accidental things that can happen in the laboratory. Now, furthermore, current biosafety guidelines often fail to adequately address these evolving factors such as urbanization, such as the climate change, such as the increasing of use of molecular tools, and which can amplify both the benefits and the risks associated with arboviruses research or arboviruses activities. Now, the global health community needs a harmonized framework and based on evidence-driven risk analysis to reduce these inconsistencies, certainly, and close biosafety gaps. So by investing in these studies, arbovirus, particularly arbovirus biosafety, it is not only essential to protect the laboratory workers, but also to protect the communities, to ensure that there is going to be like a continuity and the trustworthiness of critical biological research. So that is basically what we have on the summary. Again, it's a very interesting article, and just the topic can lead us to see like many things that are something around all these things. And unfortunately, inadequate biosafety practices in endemic areas pose an increased risk due to the presence of competent vectors such as Aedes aegypti. So important to consider these things. And now I'm going to throw for you the first quiz that I developed. And the quiz says, hold on with me, please. So here we go. In your institution or region, how is dengue classified for biosafety purposes? Is it classified as a risk group 2? Is it classified as a risk group 3 with high individual risk, moderate community risk? The classification will depend on the activity being performed. Dengue is not specifically classified in my region. That can happen as well. I don't know, or I don't want to answer. So those are the options that we have, ladies and gentlemen. So again, in your institution or region, how is dengue virus classified for biosafety purposes? Risk group 2, risk group 3. Classification depends on the activity performed. I mean, diagnostic versus animal work. The other option is dengue is not specifically classified in my region. I don't know, or I don't want to answer. And I'm going to give 10 more seconds, ladies and gentlemen, 10 more seconds to gather all the possible responses. It's going to be interesting to see. And we are doing this only for dengue virus. Imagine that we are just replicating this to many of the other arboviruses. Okay, so I'm stopping the poll right now, and here you will see. So the results, the people voted that 29% said it's a risk group 2, 6% classify that as a risk group 3, 12% classifies depending on the activity being performed. I mean, if it's a diagnostic activity, if it's animal work. At 12% said that dengue is not specifically classified in the region, and 35% say, I don't know, and 6%, I don't want to answer. So, okay, so that was our first question for today. And what it is very important is the following set of slides. So, the introduction of the article highlights the biosafety challenges posed by dengue virus, and which is a major public health concern in tropical and subtropical regions, particularly to its mosquito-borne nature. It underlines the importance of WHO Laboratory Biosafety Manual, the 4th edition, and promotes a risk-based approach tailored to available evidence and local conditions. So the authors argue that biosafety and biosecurity landscape for dengue is fragmented globally, which I agree with that, because that leads to different types of containment protocols, inconsistent classification, and the placement of these viruses in different risk groups, and incomplete understanding of the infectious dose. So that is something very important that I want to highlight here. For so many pathogens, we do know the infectious dose. For example, Mycobacterium tuberculosis is 1 to 10 bacillus, but there are so many pathogens that do not have an infectious dose, which is important to consider additional measures. And this lack of harmonization weakness the global preparedness for dengue outbreaks and undermines safety in laboratory and research settings. That is something that it is impacting all our institutions. And therefore, this article positions itself as a call for unified evidence-driven biosafety standards to guide in the right classification, but also in the right way, so that we can use all the existing resources in low and middle income countries. But also, I would like to say not only low and middle income countries, but I would like to say like in every institution that works with dengue virus, because I do know that in so many places, so many countries, it is required to notify these to the Ministry of Health, because it is a communicable disease. So that's why we are seeing this. It's, I mean, I agree that we needed to provide like a unified framework and classification for doing these activities, so that people can understand that and can develop the trainings, the tools, and other resources that are needed for working with the virus. Now, let's go and move into the general characteristics. So, but one of the things that I wanna discuss here before going to the general characteristics are that please have in mind or consider all the information that you have received and how or what is information that you currently have at your institution, okay? So that we can make a comparison. And I know that some of you are going to start like saying like, well, in my institution I have this, or in my institution I have other situations that I need to consider when doing the classification. But we will see this in just a few seconds. So general characteristics. So dengue virus belongs to the Flaviviridae family and exists as four genetically distinct serotypes. So this is classified into dengue 1, 2, 3, and 4. And these share about the 65 to the 70% approximately of nucleotide homology. So these serotypes can each provoke different immune responses, like notably secondary infections by a different serotype increases the risk of severe disease due to antibody-dependent enhancement. Now, this biological activity diversity makes vaccine development very complex. It is not impossible, again, but it makes like very complicated, such as like HIV, which it's complicated as well. And and also this raises the concerns in research settings due to unpredictable clinical outcomes. So what it is important to know is that, I mean, there are four serotypes. There's a lot of people and experts talking about that could be a potential fifth serotype if it's not ready there. But that is something that I will let like the experts talk and discuss about this. But it is important that in some countries, the serotypes, the four serotypes are circulating, while in other regions, only a few serotypes are being found based on the epidemiological surveillance studies. Now, when we talk about general characteristics, the dengue virus infection has a broad clinical spectrum, ranging from mild flu-like symptoms to life-threatening conditions, such as dengue hemorrhagic fever and dengue shock syndrome. So the illness follows a triphasic pattern, which is febrile, critical, and convalescent. And the severe complications, especially during the critical phase, include the plasma leakage, the bleeding, and the organ failure. And in some cases, people develop different degrees of the disease based on many factors, immunological response, and so on. But biosafety concerns arise in hospitals and labs during these phases, especially when handling these blood samples from critical patients due to high viral loads. So that is something very important to consider, as well as you know, biosafety is not only for laboratory, but also for clinical settings, which are the ones that are seeing like the patients, but also transporting these samples from the patient's room to the laboratory for sure. Now, the modes of transmission, so it is a vector-borne transmission via Aedes aegypti and Aedes albopictus, and is the primary route. However, non-vector transmission, such as vertical, mother-to-child transfusion, and organ transplantation are increasingly recognized. And we do know that the blood banks have like a very high risk if the blood is not being screened. So this is definitely something to consider. And the occupational exposure, especially through aerosols, needle stick injuries, which have been reported, and infected mosquito bites poses significant risks to the laboratories and in clinical settings. And people at the beginning, I mean, if you can take a look into the literature, you will see that there have been some exposures and that are not related directly with being in contact with the mosquito. So interesting facts about this. Now, when we talk about the treatment and prophylaxis, there is no specific antiviral treatment for dengue. Supportive care remains the mainstay, basically. And there's one vaccine, and that vaccine, the name is the Dengue vaccine. Is the only widely approved vaccine, but it carries some risks in seronegative individuals. So there has been other efforts that have been approved in Indonesia for broader use, and these developments highlight the need for cautious biosafety during vaccine trials and post-marketing surveillance. So, I mean, we are seeing now an era when we are seeing like the development of more vaccines. However, all these vaccines needs to be approved and needs to go to each one of these phases of the clinical trials, so that can be used in different populations. And in some cases, for example, there are some countries that will not recommend the use of the vaccine because of the allergic reactions that may have, or secondary effects, or even because they don't consider that necessarily. So again, this is something that even if we are developing vaccines, even if we are developing new treatments, maybe not all the countries are going to support this idea, which that is one of the points on this article that leads us to unified or these criteria about what are the things that we need to do. Then when we move to biosafety in the lab, the risk group classification varies globally. Classified in the US as biosafety level 2, risk group 2 pathogen, and Australia. But for example, in the European Union, it has been classified as a risk group 3, and United Kingdom as well. And this discrepancy leads to differences in required biosafety levels. And in some places, it is easy to do this because maybe I already have a BSL-3, a facility that has these containment levels. But in so many cases, I don't see that countries that don't have like BSL-3 is going to build a BSL-3 just because they're going to work with dengue viruses. So, and that's why we wanted to bring here the document of the WHO, because that completely eliminates the risk group levels and the biosafety levels, so that we can do our risk assessment, and based on that we can develop these activities at different containment levels. Now, in terms of I mean, there's a lack of sometimes standards, and particularly the spaces that are being more regulated are clinical labs. But what about research labs? What about universities that from night to day want to start working with the mosquitoes? What about the laboratories or the scientists that start working with influenza and now wanted to do some dengue virus research? Or what about all the professionals that are studying like molecular particles and chemical compounds, and now they want to work with biological materials without having the training and the knowledge of what is being required on biological safety? So as you can see, we are seeing here like different aspects that we need to consider when analyzing all these articles. Now, the infectious dose. Dengue virus is highly infectious. So it's fewer than a PFUs, and that can cause human infection. And the human viremia ranges from 10.5 to 10.8 copies per milliliter. And some studies with mosquitoes reveal a varying susceptibility among serotypes, with dengue 3 virus and dengue 4 virus requiring higher doses to infect. And this data supports the need of having stricter controls, that's for sure, in the labs that are performing like viral cultures. And again, not all the laboratories are performing the same activities. There are some of them that only do like serology testing, but there are so many that do like multiple activities, and that's when we will need to consider all these critical aspects on the research and the activities and the personnel that is being exposed to these potential risks. Now, when we talk about the biocontainment level and the personal protective equipment, dengue virus work under BSL-2 with the personal protective equipment that includes the lab coats or lab gowns, the gloves, and some laboratories use like a double pair of gloves, which, I mean, it is fine depending on, again, the activity, the biosafety level, or the containment level that you are performing these activities. And eye protection. This is something very important because sometimes, even when we take a look in the way of on how this pathogen is going to be transmitted, that doesn't mean that the pathogens cannot be easily aerosolized, and that is something concerned because many laboratory acquired infections occur because of aerosol exposure, and it was a pathogen that it was not the mainly root of infection, but something happened in the lab. The pathogen or the biological material was aerosolized, and oops, that person was exposed. Now, for high risk tasks or vector work, BSL-3 practices and arthropod containment level 2 or 3 are advised. And I put here in one of the slides these arthropod containment guidelines. It is the latest version, it is my understanding. But these can guide institutions that want to work with the mosquito, with the vectors, to see what they need to be compliant. Because again, we also have biosafety levels for arthropod containment, and that can make things like a little bit complicated in some institutions. And for example, for working in these insectaries, that will include the Tyvek suits or the coveralls, the double gloves, the mosquito-proof enclosures, which would be like a plastic curtains before going in the room, having like an anteroom as well, and different containment measures. And containment breaches often result in the lack of the use of the personal protective equipment, and of course, using facilities that have not been validated or certified for such purposes. So we're seeing here like a chaining reaction of the people that do not have those facilities, but that are not being compliant in terms of personal protective equipment and other stuff. Now, let's move to the one of the sad parts of this article. But in general, one of the sad parts of the human nature when doing life science experiments, and that is that the laboratory acquired infections are part of, or have been part of, the human nature since forever. And 9 laboratory acquired infections have been documented from the 60s decade, 1968, to 2018, caused by needle stick injuries, the mosquito bites, or aerosol exposure, as I was just saying. And these cases occur across diverse geographic settings and underscore failures in PPE, the training, and facility design. So there are some of these lessons calls to enhance the protocols and to reinforce the surveillance programs, but also to have like better reporting systems. And when we talk about laboratory acquired infections, it is just about what are the things that I am notifying at my institutions. I mean, if you see something, say something. And I love the idea of reporting every time, not because we are going to punish that person, but just because we need to recognize what went wrong and what can we do to prevent that from happening again. So that is something extremely, extremely important. Now, let's move to the disinfection and decontamination. The paper states that the dengue virus is inactivated by heat at 56 Celsius for 30 minutes. And autoclaving, the UV light, 45 minutes exposure, and various chemicals such as the use of formalin, the TMBP, the methylene blue are some of the things that can definitely inactivate these virus. Some of these methods are critical for preventing cross-contamination and ensuring the safe disposal of infectious material in laboratories and healthcare settings. But we're going to discuss a little some of the things that I just wrote something that I am going to share with you in a few seconds regarding the disinfection and decontamination So that is something that important to consider in this analysis. Now, when we go to the discussion, and a major issue highlight is the discrepancy in international risk group classification for dengue virus. But if we think like like outside of the box, which I love to do that, I mean, what is going to happen with other viruses or with other arboviruses, particularly without moving of this out of this category? So while countries like the United States, Australia, and Canada classify dengue virus as a risk group 2 agent, suggesting moderate risk with the standard containment, European countries such as United Kingdom, Belgium, European Union members classify this as a risk group 3, which entails higher risk and requires more restrictive containment, such as BSL-3 laboratories or high containment facilities, according to WHO manual. And this entails higher risks and requires more infrastructure and more resources. Everybody or all the people or all the institutions that do have a BSL-3 laboratories, they do know that it is extremely expensive, extremely expensive to use these facilities and to maintain these facilities. So these differing assessments complicate the international research collaborations and hinder consistent containment practices. While risk group 3 implies a higher hazard for laboratory personnel and community, many countries continue to allow doing research and other activities under biosafety level 2, maybe just because they don't have the money to set up these facilities with the appropriate containment levels, even with high viral titers. So that is something concerning. And I am one of the persons, and this is my personal opinion, I am one of the persons that I do support the development of research, but we need to put into a balance if this research poses like more risks than the benefits that we are going to obtain. And one of the other things that I want to highlight here is that there are some inconsistent recommendations for the biosafety levels. So while WHO advocates for a practical implementation in terms of doing the risk assessment, the BMBL says like, no, this is the risk group classification that we have it. And again, I am not saying which document it is better in comparison with the other one. I am just saying that we will need to do like a careful assessment. And maybe in some cases, we'll consider the BMBL. In some other cases, we will need to consider the WHO. For example, let me give you an example of this. I work in the United States. And every time that I see like an opportunity to go and do like a deeper risk assessment for dengue viruses, for example, they say like, oh no, it's a BSL-2. But yeah, but what if? We need to consider that portion. What if something happens or something goes wrong? Like, oh no, we follow the BMBL and here we don't follow the WHO. For some things, we do appreciate the value of WHO, but for other things, it's like, no, we have our own regulation, and that's good. But sometimes we need to consider all the possible scenarios so that we can have like a more robust risk assessment. And activities such as mosquito infection studies, viral amplification, a large-scale vaccine production involve higher viral loads. So that is something that we will need to consider. And maybe even if, for example, if I cannot do like an upgrade in my facilities because they are old, because I don't have the money for that, I will need to put maybe in place some other practices and procedures that can help me like balance the lack of engineering controls, but I have other things that I can consider as well. That could be an option. The answer for that question, you already know that it depends. And the authors also emphasize to have like a clearer criteria, and these will need to be defined globally because we're seeing like so many changes right now with different pathogens. Arboviruses, in my personal opinion, is one of the most it's a growing concern. And let me tell you something about this I mean, we are seeing like so many reemergence of infectious diseases, and arboviruses are in that category as well. And we also have hantaviruses. We also have like many different pathogens that could be applying the same criteria in terms of unifying these criteria. So, and now I'm gonna go through this section, which is one of the things that I most enjoy of reading the articles. What was considered and what was not considered in this article. So, what was considered? So, biosafety. What are the things that were missing, in my personal opinion, about this? There's like a little confusion and or not confusion. There's like a little discussion in terms of the environmental risk of dengue virus release in endemic regions where Aedes aegypti mosquitoes are widespread. The risk is not going to be the same in a country that the disease is endemic versus the ones that are not endemic countries. So that is number one. What was missing as well in the article, I think that genomic technologies and dual use was not considered here. And the article showed like no analysis on how synthetic biology or gain of function research with dengue virus could increase biosecurity concerns. And I do remember, ladies and gentlemen, that once when I attended to a meeting in 2015, I was representing my institution, and I went to the Biological Weapons Convention, and then they were saying that they wanted to delist dengue virus of this list of potential pathogens because the risks were minimum. However, dengue virus can be used for different purposes, and this is why this pathogen was not removed at that time. Then we have another topic extremely important, and that is about the waste management. There's like an insufficient focus on how dengue virus contaminated waste, like example, mosquito cadavers, sharps that were in contact with these mosquitoes should be handled. And that is something that will vary significantly from region to region. And the waste management, it is it's just like a topic that if we discuss this, the waste management is going to be handled in different ways in different countries because of the lack of resources, because of the lack of funding, because of the lack of regulations, and so on and so on. Then is the vector surveillance integration, which is necessary to do this. And this article didn't mention some of the integrating lab biosafety with field vector surveillance or One Health frameworks. So that is extremely important to consider if we want to go and do like a deeper analysis on this. That is one of the things definitely that we need to include. And the quantitative risk modeling. And we have been talking about different techniques. And the last session we saw and discussed the Monte Carlo simulations. And these are not discussed despite their high value and high results that can be used for these purposes. So another thing it's important to consider here. And also, one of the things that I was just looking, and I would love to include like many more things, but again, I think that it is very important at this point to think everything aligned with the WHO document. Yes, that's for sure. But if we are moving forward in so many ways, like jumping into the ISO 35001, because that's what is a trending topic. That's the preferred direction. I think that we need to develop these global frameworks based on this risk, but that can be aligned to these potential documents, which is absolutely important. Now, and we need to create some mechanisms to report laboratory-acquired infections. That is definitely some of the things that in some institutions, they do have these things, and congratulations. But in some others, laboratory-acquired infections are not being reported. And they keep this as a secret because I don't want to release that information. But that information can help a lot of countries that are maybe struggling with these situations. Now, We need to promote the integration of One Health, and we need to link these laboratories research with public health and vector control labs. So that is something that, I mean, in so many countries, they do have that communication. I know that Mexico, for example, is a country that try to integrate these discussions with different government agencies, because this is not only the responsibility of the Ministry of Health, it is responsibility of different areas or different offices within the same sector. And we need to invest a lot of money. Yes, I said that correctly. We need to invest a lot of money in terms of training people in biorisk identification, biorisk management, and of course, and we need to use all the lessons learned from many countries. And Mexico is one of the countries that I know that has a very good response, very good surveillance. And they have been in different trainings, the people that are in the arboviruses lab at the National Reference Laboratory, INDRE for its acronym in Spanish. So I do know that they have a training center from WHO, and also it's a collaborating center. That's the word that I was just missing. Sorry for that. A collaborating center for WHO, which is absolutely important and necessary for the region. And this is what I was just talking about the my personal touch about these things, that it is definitely important, because you will see in this heat map that dengue, Zika, and chikungunya are commonly diagnosed in BSL2, but could require like an enhancement of different measures. While yellow fever, West Nile virus, and Japanese encephalitis will require a BSL3 due to the major pathogenicity and transmission. And emerging viruses such as Crimean Congo hemorrhagic fever could need a BSL3 or even BSL4 facilities or maximum containment facilities. Again, this is just about the perspective. This is just about what we can find in the literature. But again, the big question that I have for many of you is if you are ready for facing these scenarios, for facing these situations at our institutions. Now, I'm going to launch the second poll for today, and that one is as follows. So, have you or your institution ever had to revise containment levels or PPE protocols due to uncertainty about dengue biosafety? And there are some options here. Yes, we had to upgrade containment and PPE. Yes, we reduced the containment and PPE after a deep review. No, our protocols have remained consistent, not applicable, or I don't know, or I don't want to answer. So that is something that I want to know, because it's important. And the question is, have you or your institution ever had to revise the containment levels or PPE protocols due to uncertainty about dengue biosafety? And I'm gonna give 15 more seconds, ladies and gentlemen, 15 more seconds, so that you can finish submitting your options. And thank you so much for all the ones who participated. At this point, I am closing the poll. And here are the results. So the results, 8% said like, yes, we had to upgrade the containment and the PPE. 46% said like, no, our protocols have remained consistent. 29 said it was not applicable. 17% they don't know. And those were the numbers. Now, I'm going to go and share with you the third one and the last one of this session. And that is that Which of the following factors do you believe that contributed the most to global inconsistencies in dengue biosafety guidance? So which of the following factors do you believe contributed to the most to global inconsistencies in dengue biosafety guidance? The differences in risk perception between countries, the lack of dengue specific incident reporting data, the limited evidence on infectious dose and transmission routes, the regional variations in lab capacity and infrastructure, the inconsistent interpretation of WHO national and national guidance, the political or regulatory inertia, I don't know, or I don't want to answer. So I mean, very interesting options. Is this related to differences in risk perception, the lack of dengue specific incident reporting data, the limited evidence or infectious dose and administration routes, the regional variations in lab capacity and infrastructure, the inconsistent interpretation of WHO and national guidance, or the political or regulatory inertia? I don't know, or I don't want to answer. And I'm going to close the poll right now, and let's see the results. So here are the results. 39% voted that differences in risk perception between countries. 30% said the lack of dengue-specific incident reporting data. 13% said like limited evidence. 43% said like regional variations in lab capacity and infrastructure. 17% inconsistent interpretation of WHO and regional guidance. 13% the political or regulatory inertia. And those were the results that we obtained. So very interesting percentages between the 39% of differences in risk perception and the ones obtained with 43% in regional variations in lab capacity and infrastructure. So thank you so much for all the ones who participated in this poll today. And with that, so also one of the things that I want to say here is the aspects of biosafety and biosecurity that needs to be included definitely in so many things. So we have the biosecurity dual risks, and because we need to implement some personal reliability programs and assess the risks from synthetic biology or the gain of function research. That is important. The One Health approach is because we need to coordinate these efforts between laboratories, between entomologists and public health sectors to reduce the spillback risk and improve the outbreak response. The waste management that I mentioned, the waste management and environmental release, this article lacks of specific guidance on how to dispose biological waste, such as infected mosquitoes or in some cases the PPE. And we need to have like detailed inactivation procedures, containment of waste management, and some controls to prevent accidental release. We have the risk modeling, which we already discussed with the Monte Carlo simulations, and this is only focused on the biosafety and biosecurity. I know that we mentioned this before, but I'm just focusing on biosafety and biosecurity. And of course, having the opportunity of using the ISO 35001, I think it's a fantastic opportunity to incorporate all this information in these things that we are seeing right now. The genomic AI-driven research risks, the global surveillance and reporting systems, the facility security and access control, and the biosafety culture and institutional commitment, because we need to promote the continuous biosafety education, the onboarding, and the institutional accountability. So that is one of the things that I wanted to discuss with you all today. As you can see, very interesting article, very interesting perspective, but considering that it is a fantastic publication, I think that the publication is missing a lot of things that could be included as we were just mentioning. So now I'm going to stop the recording and we're going to go to the Q&A session.